Hi, I'm Jason Tuori, sports physical therapist and running coach out of upstate New York, discussing the middle distance runner, and you're listening to the Physical Performance Show.
And the winner is...
Failure is not an option.
I've had my ups and my downs.
I think it's an absolutely breakthrough experience.
Welcome to the Physical Performance Show, the show designed to inspire the pursuit of your physical best performance. I'm your host, Brad Beer. Listen in as we delve into how the world's top physical performers achieve their success, as well as the highs, the lows, and the journey of getting there. Let's get ready, set, let's go. Welcome to episode 287 of the Physical Performance Show, brought to you by our brand new partner, drumroll, Polar GPS watches, fitness trackers, and heart rate monitors. And of course, the Physical Performance Show's very own Learnings membership over on Patreon. I'm Brad Beer, sports physiotherapist and exercise scientist by trade and training, and founder of Pogo Physio. Each week, as you know, we'll bring you the latest and greatest information and inspiration designed to help you perform at your physical best. And of course, we do this across a range of our different episodes, interest editions, catch-up episodes, coaches' corners, featured performers, and the very popular expert editions. Now, hot off the back of some bonus episodes around Tokyo 2020/21 Olympic Games performances and recaps, we're back over to an expert edition this week exploring all things mastering the middle distance runner with US-based sports physical therapist and strength and conditioning coach Jason Tuori. By way of bio, Jason is a sports physical therapy resident at the UR Sports Medicine Center in Rochester, New York, a board-certified sports clinical specialist, a running strength and conditioning coach, and Jason himself is a very handy middle-distance 800-meter masters runner. And it is about time that we put a special focus around all things learnings when it comes to middle distance events. Now, as you'll hear Jason outline, middle distance events range from 800 meters up to 3,000 meters. And even if you are a distance runner running beyond 3,000 meters, there are still principles to acknowledge and understand, whether you're a coach, athlete, practitioner, sports scientist, that Jason will share today that will help you with performing at your own running physical best. And during today's expert edition, Jason shares around the unique demands of middle distance running, injury prevention and injury rehabilitation tips and wisdom, strength and conditioning considerations, as well as a great physical challenge coming your way. So here is my conversation with US-based sports physical therapist, mastering the middle distance runner with Jason Tuori. Jason Tuori, we've been working on this for some time, including me forgetting my laptop for the recording. So thank you for your patience, and welcome to the Physical Performance Show.
Absolutely. Thanks a lot for having me, Brad. It's definitely it's an honor for me to be on one of my favorite podcasts. So can't pass that opportunity up whenever you get the chance.
Oh, Jason, well, you have been on the must contact interview list for some time, and here we are. The theme for today's conversation is really middle distance runners, running injury prevention, strength and conditioning for middle distance runners, and rehab implications for middle distance runners. But before we explore our topic for today, are you happy to please just paint a little picture of your professional world? It's quite demanding. There's not much that you don't do.
Sure. So I'm a sports physical therapist in upstate New York, Rochester, New York, which, if you're unfamiliar, is a lot closer to Toronto than it is to New York City. So kind of thinking cold winters, hot summers, all that type of thing. My current role, I spend about 2/3 of my week in a sports outpatient clinic. The other third, I'm at a local high school, so in the training room and doing some emergency response coverage on the sidelines. So my current role here at University of Rochester Medical Center, I definitely see a lot more of the high school running population. Prior to that, I was at a private practice in Ithaca, New York, which is a nice little active town in central New York, has great running and hiking population, triathlete population. So I was seeing a lot more of the masters runner and just kind of like your average recreational running athlete in that area. I do some remote coaching when I get the chance, some strength and conditioning coaching as well. And when I get the chance outside of those other things, I like to be a middle distance runner myself. So this year I ran my first masters race according to USA Track and Field. Yeah, really, really interested in the 800. And we actually run a lot more of the mile in America, which is something unique to us, I guess. Worldwide, we think of that middle distance runner as the 800 and the 1500 runner.
The 8 and the 1500. And I'm glad you mentioned your own running exploits there, Jason, because you do run very well. And when you said by definition of the USA Track and Field, correct me if I'm wrong, but that's 35 plus according to USA Track and Field. Is that correct?
Yeah, normally it is, but for championship or local championship races, they've lowered the bar to 30. So I'm on the younger end of masters right now.
well, sorry to age you there, Jason. I was thinking of Rich Willie's definition from USA Track and Field, but no, that's great. So, right, we're talking 800 and 1500 meter distances, as you say, the mile in the US. It's a unique demand. Middle distance running, you can run up from the 400. You can run down from 3,000, 5,000, 3,000 steeplechase or 5,000. You see both work, right? But can you just sort of explain the unique demands of middle distance running? Now you've defined it as 800 meters or 1,500 meters, please, Jason.
Absolutely, yeah. So I think there isn't really a hard definition of it, but I think it's often grouped as that 800 and 15 together because the demands of them are very specific and closer to each other than outside of that barrier. So sometimes the 3K is included as like a longer version of middle distance, but typically I kind of think about that 800 to 1500 as your true middle distance population. From an energetic side of things, so that split between is it aerobic versus anaerobic and what's the overall contribution. The 800, usually when we're looking at like elite males, between like a 60 and 65% aerobic contribution, the rest being from anaerobic energy sources. For females, it's going to be slightly higher, like a 65 to 70% usually. And that's just because it's going to take 10 to 15 seconds longer per race. When you go below the 800, that's when it flips. So if you look at the 400, it's closer to like a 40% aerobic contribution. To me, that makes sense why 800 is considered like the first long distance event or distance event compared to a long sprint. When you get to the 1500, you're kind of looking at like a spread of 75 to 85% aerobic contribution. And when you get to the 3K, it's kind of even a little bit less than that. So less on the anaerobic end. So now it's kind of getting more into a traditional distance event. And the degradation in performance from 3K on is usually a little bit less than the degradation in performance when you're working in that 90 second to 300 second time frame from an energetic standpoint. This is the area where you really see this special contribution from some amount of aerobic power, but then you have to have this anaerobic component as well. And that makes for a pretty unique athlete, I would say.
And unique training programs as well and approaches. Yeah. And when you say the degradation of performance there, Jason, are you talking or referring to the drop off in run-in pace or speed?
Yeah. So that overall like time to exhaustion type curve that you would see.
I've spoken to numerous 800 meter runners, 1500 meters over the years. There seems to be a rule, as have you obviously working in your space, there seems to be a real varied view of how to best prepare one of these middle distance runners. Some talk about running lots of aerobic work, mileage. Others don't like to do too much on that side. They like to bias it more towards the greater intensity running. What can you share around your observations and also your knowledge from the literature, et cetera, and the science around best approaches for training middle distance athletes?
Yeah, so that's a great question, and I think there's been this hunt for the subgrouping of middle distance runners for a while, and Gareth Sanford has done a lot of really great work in this area. He had this great article with Trent Stellenwerf a couple of years ago, where they came out with this question this title of question your categories. So looking at this special subgroups of, say, 800 meter runners, where there's some that are more coming from a sprint background, where they're more kind of like the 400 to 800 types. There are some that were just built to run the 800. They're just built to run half a mile. Then there's some who are coming from more of the distance background, where they're more of these 1500 float down to 800 runners. And all that kind of plays into what's the strength of the athlete, what's the weakness of the athlete. From a coaching standpoint, is building up the weakness of the athlete going to take away from their natural strength? So unfortunately, I can't give you any hard answers on the how to best train the 800 meter runner, but there's definitely some pretty cool ongoing research in that area, looking at a couple key performance indicators.
I recall Dr. Stephen Seiler, former guest of the show, really world-renowned exercise physiologist and exercise science mind, sharing that was an area that he was starting to turn some attention to, is this middle distance space and this subcategories. It's interesting, as you say, there's either the runner that's born to run 800 meters, comes down from the distance, or goes up from the sprints with their background. And observationally, if you look at the place getters from the Tokyo Olympic Games, which is recently completed, in the males and the females, what would be, you might have the knowledge, you might know, but is there a mix of those different subgroups taking the podiums, or is it just, do you think, those that are the 800 meter runners that are podiuming at that level?
That's a great question too. I mean, obviously, without knowing each of those athletes, personal bests in the 400, 815, it'd be hard to comment on everyone. But from the USA side of things, we're very excited about Athing Mo over here for sure. The 19-year-old who can run the 4, she can run the 8. Wouldn't be surprised to see her with a couple of those medals by the end of her career. What's interesting is that the way that the race is run. So say the traditional like gun to tape, they're just trying to set this really fast time, probably plays a little bit better into that more of the sprint background type athlete. But it's also kind of hard to say too, because in some of the more sit and kick tactical races, maybe that athlete with the sprint background has the ability to surge in the last 100 meters. That's interesting. I'm not really sure. I know that some of the great performances that we've seen in the last couple of years do seem to be more of those either 800 specialists or a little on the lower end of the 800, 400 curve.
Jason, changing gears to sort of look at away from the unique demands, the definition of this middle distance running, to rehabilitation implications for the middle distance runner. In the lead up to Tokyo here in Australia, there was a New Zealand runner who presented for a hamstring, got his hamstring right, had one last qualifying attempt to run the New Zealand standard to be on the team for Tokyo. And during a 150-metre final run-through, he sustained a very decent calf strain injury, which took him out of his Olympic campaign and his Olympic dream. And it was a substantial injury. Middle distance presents its own demands, as you've already shared there, but what are some rehabilitation principles, implications for this group of athlete, Jason?
Yeah, definitely. I think from kind of looking at some of the injury epidemiology studies, one of the tough things about getting that data just on middle distance runners alone is in some of these studies, middle distance and long distance runners are grouped together. You're probably not always getting the same picture or the right picture of what types of injuries are we seeing out of these runners, but we can kind of think about the traditional running injuries where most of them that we see are from the knee down. That's kind of in place as a framework. And then we have these athletes that do also need to be hitting faster top speeds at relatively high frequencies per week. So then almost kind of phasing in some of the injuries that we see more commonly in sprinting, like your hamstring strains, rectum strains, calf strains, and that kind of makes up then the bulk of what you'd see in middle distance running. So most things from about the knee down, the lower leg, some bone stress injuries in those areas, and then some of your high-speed running related injuries like hamstring and calf strains. To me, the implications then from a rehab standpoint go towards what are those things that we do from rehabbing the injury, and then what are those things that we do from an injury prevention standpoint. Very, very popular to use things like the Nordic hamstring or heavy loaded eccentric exercise for the prevention of some of these acute muscle strain injuries. And from a rehab side of things, some of them are tough because we have to restore a certain amount of running volume before it's built up the cumulative tolerance to get to a certain level of running intensity. When you are talking about the different subgroups of what type of middle distance runner is this, that's when you might go one way versus the other from a rehabilitation standpoint in terms of what type of training load to restore, what to put your first priority in before getting to the next thing.
In terms of rehab versus prehab, maybe if we just jump on the prehab side of things first, it's a contentious topic of some sorts. Can we truly prevent running related injuries? The literature suggests some things, anecdotal and experience suggests others. Everyone accepts that running injuries will always occur and will still occur. But if you're approaching that, Jason, with, say, a patient, an athlete that you're working with, what are your sort of key criteria? Are you reverse engineering the demands? So as you just said, we need good hamstring capacity, we need good plantar flexor capacity, quads capacity. What might you be, well, obviously we're referring to probably strength and conditioning here, but what are the phases you might take someone through, for example, trying to prevent injuries going into a season with strength and conditioning?
I really like this new paper that Tim Gabbett and Rich Willie was one of the authors on, talking about tissue-specific capacity and sport-specific capacity. And I think you have to talk about both of those components when it comes to training or the injury risk reduction talk. I think from a local tissue capacity standpoint, we can confidently say at this point that if you've had an injury in an area in the past, that's one of the bigger risk factors for having that type of injury again. And that's pretty much the only thing that we can confidently say about predicting injuries in running is just that the history of having something in the past. Mm-hmm. So if you have a runner with a relatively recent injury or they've just gotten over that injury, probably one of the first things in mind is we need to continue to build that local tissue capacity. So let's say the middle distance runner with the hamstring strain, well, we want to see that hamstring can produce a high amount of eccentric force within, let's say, 90% of the other side, ideally 100%, but we work in the real life and we want to probably see, from a hamstring function standpoint, can it work well from a knee flexor standpoint? Can it work well from a hip extensor standpoint as well? In addition to making sure that everything else from the rest of the kinetic chain, the gastroc soleus, the quadriceps, hip abductors, that they're all relatively symmetrical side to side. That's kind of what I think about from a local tissue capacity standpoint. Max strength, and if we have the ability to take some type of power measurements. Outside of that, from the sport specific capacity standpoint, that's when I think it's this interesting talk about, well, what does their regular training look like? If they're more in the sprint end of an 800 meter runner, we'll say, well, their weekly training volume, maybe it's as low as 40 kilometers in a week. For an elite runner, it's not unheard of that their weekly volume is actually quite low relative to somebody who's more on the 15-8 side of things, who comes from more of the aerobic background, and maybe they're between 70 and 170 kilometers per week. That's then when you have to say, what does the bulk of their training have to look like? What amount of their training volume do we have to restore before progressing into some of the higher intensity type running that also has to be restored before returning to an 800 or 1500 meter race? It's much more difficult when you have the race where there's two different types of athletes coming from different backgrounds, because then you have to try to just make that call of, I think this arbitrary amount of their weekly volume is a fine thing to restore before we start to get into some of their higher intensity workouts, because we do know that in general, the differences between the 800 and the 1500 runner anyway are that the 1500 runner is going to have a little bit of a higher frequency and duration of the easy runs, and the 800 runner is probably going to have a higher frequency of some of the high speed running.
And in terms of restoring the aerobic base, if you like, or the aerobic work component of their overall workload before going into some higher intensity, call it anaerobic if you like, work, there's no known algorithms, right? It is still very much probably more art than science on that side of things. I mean, I very simply, obviously there's circumstances where this changes, but with rehabilitating running related injuries, often talk about restoring 80% of the aerobic base before we then start talking about intensity work. The reason being, I find that's an easier sell than 100% return of workload before we start. Okay. So, but anything you'd add to this, Jason? This sort of
There's like you said, there is no known benchmark of like what's the minimal amount. What's that minimal effective amount that we have to restore before then progressing on to the next thing. I think you can probably make a case that it has to change based on a few key variables. So what type of tissue was injured? And that kind of pushes us more towards it needs to be conservative versus we can be a little bit more accelerated with it. How much time do we have until the competition? It's obviously a big one. And how long were they away from running? How fast can we bring their training load back up? A couple of things like that kind of help shape that initial art, or the educated guess and check would be the more scientific definition.
Educated guess and check. Yeah. I like that. And, so there's a few considerations there. As you say, Jason, reverse engineering from an upcoming event, the tissue type of what was injured, was it soft tissue, was it bone? How does that change things, Jason? I assume you'd be thinking, right, bony tissue, there's a lot less tolerance for being too aggressive with the changing of the program.
Yeah, precisely. So especially with something like a high risk bone stress injury site, our threshold for shutting it down needs to be very strict. And we do need to be very conservative with that, because that has long-term implications from a rehab standpoint if that doesn't go well. Typically our soft tissue injuries or our envelope of function type injuries like patellofemoral pain or iliotibial band syndrome, those ones we probably put a little longer leash to, mostly because we know that, well, if it flares up, we're not really doing much damage to it. It's just that it wasn't ready to progress, and that's okay. The time to competition is definitely a big one. And there were probably a lot of athletes who either went to Tokyo and weren't able to actually make it to the starting line because they had just this very, very small time frame from the time that they got injured to when they needed to perform. And that's tough because sometimes you're peaking at the right time, but an injury is going to derail some things. And we know that high performance is not healthy. So at a certain point, you're kind of taking the fork in the road to say, I want to try to push my body to performance. And that is going to increase a risk of injury.
Yeah, gosh, that's so well stated. High performance is not healthy. It brings with it an inherent risk just by the very definition. And we're talking about prevention of running-related injuries in the middle distance runner here, Jason. And you mentioned this delineation between tissue-specific capacity and sport-specific capacity. You've just shared so well on the sport-specific capacity. You touched before on the tissue-specific capacity, strengthening up elements of the kinetic chain, muscle groups, etc. A question, Jason, is, you mentioned that you would look at max strength and power measurements if they're available. Are you working typically with your athletes off benchmarks as multiples of body weight per muscle group? It's a tricky one, right? But any learnings you've picked up from your career so far and helping practitioners or athletes or coaches out there in terms of what they might be trying to target and hit?
Yeah, this is a tough one. I always go back and forth on this, the hitting normative benchmark data versus trying to achieve symmetry. And you can make a solid case for either one. You could say that, well, if somebody is symmetrical, then that's what's been working for them so far. And you could also make the case that, well, if they didn't hit this certain normative data that that's the reason why it wasn't working for them, and that's why they're in here injured too. So we know these things about like the soleus taking on massive number of body weights, and the hamstring muscle also taking on multiples of body weights as you approach higher speed running. In addition to, say, the patellofemoral joint and quadriceps being that biggest amount of overcoming braking force as well. So I do always think it's hard to say like this person needs to hit this number of body weights. Clinically, I rehab a lot of ACL injuries, and I think that's a different story where we do see that we want somebody's quadriceps peak torque to body weight ratio to be greater than 100% of their body weight, or at least at 100% or beyond. But from a running standpoint, I'm not so sure that I am tied to any specific benchmarks. I mean, maybe some low threshold benchmarks, like if somebody can't hit 10 single leg heel raises, 10 being an arbitrary number, but a relatively low number, that's pretty alarming. But it's probably rare that I would see that side to side and have that be somebody's normal amount too.
That makes sense. I know clinically I've worked largely off someone like a Peter Maliaris here in Australia, a well-known tendon researcher who clinically works with some benchmarks around multiples of body weight, and I'll often share with patients that, hey, look, this could be based on your body weight an ideal target, but the reality is you may get nowhere near that, but as long as you improve from where you are, then we're likely winning the game for that specific intervention. And power measurements, Jason, any go-to power measurements that you like to do for your middle distance runners, special tests?
Yeah. So lately, one of the things that I've really enjoyed doing, I don't have force plates at my current clinic, but I do have this $10 MyJump app. And so with the $10 MyJump app, you can get somebody's reactive strength ratio. And so the reactive strength ratio is if you're doing a depth jump, which is just starting up on a box, taking a step off, landing and trying to maintain as little time on the ground as possible, and then doing a vertical jump into the air, landing again. It's basically the ratio between the amount of time they were on the ground and the amount of time they were in the air. And this is another one that doesn't have great normative data, but I do typically like to look at that number and kind of take it as a measure of reactive strength or a power type measurement to see that, well, if somebody has a pretty good ability to generate a lot of force in a very small ground contact time, albeit this is typically a double leg test, well, then they have this pretty necessary stretch shortening efficiency that you need for high speed running. Sometimes I will look at that as a single leg drop jump as well, side to side. Oftentimes in rehab, I will look at that to see that they've regained reactive strength symmetry side to side. But I have been enjoying looking at that at certain time points, say in some of the athletes that I coach, to kind of use that as a benchmark for some of our strength conditioning or plyometric progressions as well.
That's a really nice insight there, Jason, with this reactive strength. Does the size of the step they're jumping off, the athlete's jumping off, obviously has to stay consistent, but is there any go-to step height that you stipulate?
Yeah, typically I just use a 12-inch, but yeah, I think you can do it with anything between 8 inches, and it's usually not recommended to do much higher than 24 inches, I believe. But that's going to change the ratio as well. Obviously, the higher the height that they're stepping off of, the longer ground contact time there's naturally going to be.
And numerically, what do these ratios sort of look like? What numbers are you sort of getting?
I'd say probably anywhere between a little over 1, which is on the low end, and up to 3, which is on the elite end. So a very big spectrum in between those. And that would be for double leg. For single leg, it's a lot more variable that I've seen.
And that's reflecting this ability to generate large amounts of force with very short contact times. So hence the bigger the number ratio-wise, the better.
The better it is. Yeah.
Any other power tests or measurements, metrics, Jason, that you find very helpful for middle distance runners, preventative-wise or rehabilitation-wise?
I typically do the same thing with kind of like a single leg pogo hop or double leg pogo hop, just looking at the overall height That and the occasional single leg vertical jump. Those are kind of some power measurements that I would take along the way as well. Because if we're in a block where we're working on more explosive strength or plyometric exercises, it's helpful to have kind of like a test, retest, a baseline, and then a further down the road to see that we're making some sort of meaningful change.
And they're using the My Jump app, for example, with those as well.
Yep. Yeah. It's pretty easy app. You get this like slow down camera. You can pick the exact frame that they leave the ground and pick the frame that they come back down. You have their leg length and another measurement of their body position and their body weight. And it does all the calculations for you.
Brilliant clinical and coaching based tip there, Jason. Yeah. That's excellent. And maximum strength, any go-to tips there around how to quantify that?
Yeah, I will typically set up some isometric strength testing. I find that that's quite a bit easier than doing like a graded 1 repetition max for different types of lifts. I will also usually just do like an estimated 1 repetition max based on a couple key lifts that somebody is doing. But lately I really haven't been focused that much on the very heavy strength training with a couple of my athletes, mainly just depending on the part of the season that they're in, their strength conditioning background, all sorts of stuff like that. But typically I'd say either some sort of estimated 1 repetition max or an isometric, whether it's like a mid-thigh pull or a specific muscle group isometric testing is easy enough to rig up with some dynamometers.
Yeah. And for example, that could look like isometric hip abduction or adduction or seated calf raise for.
Yeah, exactly. Yeah. Pushing into a dynamometer side to side, or a force plate if you have it, doing a knee bent soleus test into a force plate.
Jason, talking about adductors or the inner thigh muscles, if you like. I find clinically it's an area that I think is very important, but scientifically I don't really see a lot often around the adductors, the adductors. Any sort of go-to tests or any tips you've picked up about the importance of this muscle group specifically throughout your career to date?
Yeah, certainly you see a lot more literature on adductor injuries and the strength training associated with it in some of our field sports, say soccer or change of direction sports like ice hockey. But I agree with you that it's probably one of the more neglected lumbopelvic hip area muscles from a strength training side of things. From a testing standpoint, I typically prefer just a supine, someone's lying down on their back, pushing inward against a dynamometer and just doing an isometric test that way. From a training standpoint, we do have a lot of this literature now on that includes the Copenhagen adductor plank. That's the opposite of an abductor plank or a side plank where your top leg is pushing down. That does seem to have some benefits in the team sport area with kind of like your hip pain and groin pain reduction. From a running standpoint, I'd say some sort of adductor plank or some sort of lateral lunge are typical exercises that I'd have in somebody's regular routine. But I agree with you. I think that it probably is more important than it's been given credit for sagittal plane sports thus far.
You're listening to episode 287 of the Physical Performance Show on this expert edition featuring Jason Tuori, US-based sports physical therapist, sharing around all things mastering the middle distance runner. Support for today's show comes from Polar and their incredible range of sports GPS watches, fitness trackers, and heart rate monitors. Now, as you know, the Physical Performance Show is here to help you pursue your own physical best performance. And we're so excited to have partnered with Polar. Polar are a sports technology company who build world-class heart rate monitors and GPS watches for people who take their health, fitness, and sports performance seriously. Polar have an incredible heritage. Headquartered in Finland, they have been the global driving force behind scientific wearables for over 4 decades. They are the pioneers in and the world leaders in heart rate measurement technology. Polar's products provide you with 24/7 monitoring to enable you to plan better, train smarter, recover fully so you can be at your physical best. Coming from the heart of the Nordics, Polar have the experience, insight, and history of quality, design, and innovation which is unparalleled. Polar is worn by some of the best athletes on the planet. We're very excited to have partnered with Polar so you can also access their heart rate monitors, watches, and training platform. And as a starting bonus, the team at Polar have generously offered up 15% off their GPS watches and wearables. If it's time for you to check out a new heart rate monitor or watch to help improve your performance, then head across to polar.com and use the code TPPS in capitals on any selected product. Personally, I recall my very first heart rate monitor in the 90s as a junior triathlete being a Polar strap, and the company have continued to evolve ever since then. So do jump over to polar.com and take advantage of 15% off any of the Polar range. Support for today's show also comes from the Physical Performance Show's very own Learnings membership. If you'd like to support production of the show, you can do so from just $5 per month over at patreon.com. Just search for the Physical Performance Show, and in return, we'll grant you free access to all of our upcoming live stream events and our back catalogue of live stream events as well. In 2020, we hosted Dr. Stephen Seiler around all things polarized training and Dr. Shona Halson around all things optimizing recovery. And on the 23rd of October, we will be hosting Rinny McGregor, UK-based sports dietitian and author, who will be presenting a live stream titled Fueling the Endurance Athlete. Now, you can also access this live stream without being a Patreon member of the Physical Performance Show. Tickets are $49 Australian and are available over at pogophysio.com.au/Rinny McGregor live stream. And lastly, support for today's show also comes from Pogo Physio's online telehealth consultations. If you are an endurance athlete struggling with bone stress injuries, tendon conditions such as Achilles tendinopathy, or perhaps plantar fasciitis, kneecap pain, IT band pain, or any of the common running-related injuries, then you can schedule your 45-minute online telehealth consultation with myself or any of the Pogo Physio team by jumping over to pogophysio.com.au/telehealth. For now, let's jump back with this week's featured guest on this expert edition, Jason Tuori, US-based sports physical therapist on all things mastering the middle distance runner. Brought to you by Polar's GPS watches, fitness trackers, and their online training platform. Jason, you've shared so far around the unique running demands of the middle distance events, also running injury prevention, rehabilitation principles and implications. You've shared around this concept of tissue-specific capacity, sport-specific capacity in terms of injury prevention, but there's also a whole other side to strength and conditioning for the middle distance runner, and that is that of performance. We've shared in the past with expert editions such as Richard Blagrove around the benefits of strength and conditioning for runners. But specifically the middle distance runner, what can you share around the benefits of strength and conditioning for the middle distance runner in terms of performance and also injury prevention, of course?
Right. Yeah. So we definitely have better evidence that shows that strength training is a good modality to improve performance. We have better evidence that shows that rather than any type of injury prevention data on that. I think what we could say is just from the basics of what a middle distance runner needs to do, they need to have great max sprint speed capability as well as a good aerobic power base. Well, one of the huge components of max sprint speed is how much force can you put into the ground? And oftentimes that's a limiting factor for maximal sprint speed. So one of the things that strength and conditioning does is it improves force production. So there's pretty good line of thinking then if we're integrating strength training at a reasonable frequency, obviously going to be different depending on the time of season, but that's going to be a good modality to help improve at least the maximal sprint or the anaerobic end of things when it comes to middle distance running.
How much force can the athlete put into the ground? You just mentioned there, Jason, it's going to vary depending on the time of the season. this is bringing up the concept of periodizing an athlete's year. Can you share around phases that you tend to categorize for these middle distance athletes?
Yeah, so the periodization is obviously a very messy topic, and I think you have like the ideal situation versus the what you actually do. Oftentimes, the ideal or traditional model of that linear periodization thinking is like when you're in the off season, you're building general strength and work capacity. As you transition into preseason, working more on maximal strength and power, and then in season, trying to just maintain things as long as you can. That sounds nice theoretically, but for a lot of track and field athletes, they have more than one competition a year. And so there are multiple ebbs and flows of their season. They may not have a very long off season between, say, the indoor and outdoor seasons. So I tend to adapt more of like a block model where we're just working on pretty much anything that we need to improve various times a week and maybe changing it every couple of weeks. So an example of, say, working on somebody's gastroc soleus complex, we may still want to improve their work capacity or their strength endurance. We may also want to improve their maximal strength. So repping out between 4 and 6 repetitions of something until failure. And we may also want to be working on reactive strength. So something like single leg pogo jump. Those things might all appear in a span of 2 weeks, as opposed to just working on the maximal strength over the course of an off season and then progressing into those higher level power exercises as you get closer to the season. Because one of the main things that we have to remember about strength training is that this is a modality to help improve performance. So what we shouldn't be doing is prioritizing strength training over the key running sessions. If strength training gets in the way of those sessions, then there's going to be an issue. It really isn't about going in and having these legendary leg days and then coming out and having them ruin the track session the next day.
It's a key point, a key learning that you've shared there, Jason, and certainly that was echoed by Dr. Stephen Seiler when the question arose with his 2020 live stream around polarized training, and that question came up, and that was more or less his exact response, Jason, was the S&C work should never be at the expense of key running workouts. So nice to hear that reiterated from yourself there. And you use the phrase block model as opposed to the ideal traditional linear model of periodizing a season. And as you say, there's more than one event per year. So the athlete does need to ebb and flow in and out of those. But within a given S&C workout, Jason, how do practitioners, coaches, athletes, do they cross-pollinate the purposes of a session? So might they be working on endurance in the same session that they're working on, maximum force production or reactive speed, or depends? Yeah,
I think it's actually pretty common to see a lot of different attributes being worked on in the same session. So a typical session flow for myself would be prioritizing some of your power or plyometric movements up top, and then some more of the maximal strength exercises after that. And then any type of accessory or work capacity more in the strength endurance realm following that. Yeah, I think you're going to be able to work on more per a given weekly cycle if you separate things out like that, rather than say today is only a plyometric day or Tuesday is only a maximal strength day. You're probably going to limit the total amount that you can actually work on if you separate those things like that.
Jason, go-to exercises that you just really find beneficial for your athletes in terms of prescription?
It's going to sound pretty boring, but the fundamental strength training exercises, I do like a good combination of both bilateral squat and hinge or deadlift patterns and unilateral squat and hinge patterns. On the rehab side of things, I tend to gravitate more towards the unilateral to try to prevent any type of overcompensation if somebody clearly has an injury or a weaker side. But from the just traditional performance training, bilateral versions of squats and deadlifts, unilateral versions, and then your key accessories, which I tend to fill in both based on the demands of running and based on that athlete's injury history. So we'll take it back to the hamstring strain example. That runner would probably have an extra hamstring accessory exercise, whether it was an eccentric overload like a Nordic hamstring, or even just a basic hamstring curl machine type accessory work. And you can't obviously forget about the gastroc-soleus. It's a popular muscle to be training right now. So that's kind of always a component to me is in some capacity working, whether they need to be working more on the maximal strength side of things or the work capacity or their reactive strength in that area.
And on the gastroc-soleus, fellow expert edition of the show, Dr. Rich Willey, he's labelled the soleus as the monster of the running body, given its force development characteristics, always working hard, up to 8 times body weight, as opposed to something that's phasic like the hamstrings or the gastroc, scales up as the demands get higher. Any go-to exercises you particularly like for the plantar flexors, the gastroc and the soleus, Jason?
Yeah, I'd say my two biggest that I use are using a Smith machine, back squat position, doing a single leg, straight knee, calf raise off of a step. So just loading up in the knee straight position. I prefer the Smith machine because it takes balance out of the equation. As in vogue as it is to criticize the Smith machine, it actually serves a very good purpose of making the exercise not a balance exercise and being able to actually get done what needs to get done. And then I still do gravitate towards the bent knee seated calf raise machine. I know that there's been some talk recently about, is it necessary to train the calf with the knee bent versus the knee straight if the soleus is working during both angles. And I think from a training variability standpoint, it just helps to change the mode of the exercise sometimes. So I tend to do very isolated, controlled knee straight, knee bent, and try to get as much balance out of the equation as possible so that the goal of the exercise can be force output.
And in terms of time under tension, would you be varying that at all? Time under tension for these exercises?
Yeah, I would say it would be specific to what are we trying to train in that session. So if somebody is in more of that maximal strength, 4 to 6 repetition range, I just want to see a relatively slow, controlled tempo through those repetitions. Then if it's more in that work capacity of your traditional 8 to 15 repetitions, you're naturally going to accumulate more time under tension just by hitting those higher repetition ranges. So in that case, it would be more a product of what's the goal that we're working on in this session.
And in terms of prescription indices for reactive, trying to train reactive or power-based metrics, what prescription variables might you use in those sorts of exercises, Jason?
Yeah. So for the pogo hop, we'll say this is then going to be dependent on, are we working on minimizing ground contact time, or are we maximizing height? So for me, if I want to have this more kind of springy jump rope, quick off the ground, but not too focused on a lot of height, I'm going to categorize that more as your low intensity reactive. And I'm okay with seeing a few sets of 8 to 15 repetition because it's more on the lower end of that. If we're working on your kind of explosive pogo hop, so I want your head to get up to the ceiling, and I also want you to maintain a pretty short ground contact time, that's when I'm going to usually stick to the kind of traditional 3 to 5 sets, 3 to 5 repetitions. So keeping the volume per set relatively small and the volume per session relatively small as well.
And the rationale for that being?
Typically with that more explosive pogo hop, we're significantly increasing the amount of force that goes into the gastroc-soleus and Achilles tendon. So that's where we just want to be a little more judicious with how much total volume we're working on those the higher intensity plyometric exercises. Similar to say like the drop jump as well. It's pretty rare to see somebody do more than 3 to 5 repetitions per set of a drop jump.
Yeah, and most of us that have done those can understand why we're quite happy to adhere to the 3 to 5 by about 3 to 5 reps and set range. That's for sure. Anything Jason, you'd add on strength and conditioning for the middle distance runner before we explore something that has gained a lot of attention in the running world, and that's the footwear side of things. But anything else you think is important to mention regarding strength and conditioning for the middle distance runner?
Yeah, I think the first thing to think about is that don't let the strength and conditioning session affect your running training load for the week. And in those cases, one of the things that Richard Blagrove has been talking about lately is breaking up the strength training sessions into smaller micro blocks. And I think that can work really well from a sustainable training standpoint, because maybe your strength training session is a couple blocks of 15 minutes or 30 minutes instead of spending 60 to 90 minutes in the gym. That can work really well from a scheduling standpoint, and it can also work pretty well just from preventing delayed onset muscle soreness by doing a huge volume of things in a relatively short period of time. That kind of also has some issues if somebody can't get to the gym 5 to 6 days a week. So there are definitely limitations on that front, but I really have been gravitating more towards these smaller micro blocks of strength training, as long as the total weekly volume is matched between both methods.
And an example of a micro block, and I know Dr. Rich Willie's referenced these as training units, where something's better than nothing, even from a home perspective. But in this situation, in this example, Jason, might that be 3 to 4 exercises or 2 to 3 or maybe even 2, or it depends?
Yeah, exactly. Maybe like between 1 to 3 exercises rather than a 6 to 8 exercise block broken up across multiple days, as opposed to all in one session.
And many runners, I guess maybe it's a generalization, but more so maybe the distance runners, longer distance, 800 or 3,000 meters plus, don't always have a real affinity for gyms and strength and conditioning. So it might be somewhat more appeasing or appetizing to runners that do have a little bit of resistance, pardon the pun, or pushback to the S&C setting, right?
Right. Yeah. When you can kind of sell it as like, this is the minimal effective dosage, so you really don't need to do much more in this session. I think that works well for some folks. Then you also do have the folks that they don't feel like they've gotten a workout unless they're totally gassed. And so then they're probably the ones who are less satisfied with these micro blocks of training, where they're like, I still got way more gas in the tank. What are we doing here?
Yeah, absolutely. And anything else on the S&C front for the middle distance runner, Jason?
Yeah, I think, just the classic traditional strength and conditioning exercises has been around for a long time. I'm definitely more of a traditionalist in that way. So you have a good combination of multi-joint and accessory exercises. You have some bilateral, you have some unilateral, and if you've done the appropriate assessment to see what's that runner's need at the start of a training block, then a lot of the pieces can kind of solve themselves based on that prescription.
You're listening to Jason Tuori on this expert edition of the Physical Performance Show, focusing on all things mastering the middle distance runner. If you missed last week's episode of the Physical Performance Show, we brought you a combo episode featuring recently crowned Olympic triathlon champion Christian Blumenfeld and Olympic triathlon bronze medalist Hayden Wild. Now, both Hayden and Christian have been prior guests of the show, and it was a real buzz to catch up with them off the back of their Tokyo Olympic Games success. To enjoy the full episode, jump over to wherever it is that you enjoy the show from, including the show now being available on YouTube. Whilst there, peruse the archives dating right back to episode 1, featuring surf lifesaving Ironman champion Ali Day. For now, let's jump back with this week's featured guest, Jason Tuori, on all things mastering the middle distance runner. If we think now, change gears, Jason, to footwear for the middle distance athlete, the big difference is fairly obvious, and that is distance runners will run in different shoes, particularly on, say, the road, to a track athlete running an 8 or a 1,500 meter running in spikes. So what are the demands? How do the demands change with spikes? What considerations should there be for the 800 to 1,500 meter runner wearing spikes?
Definitely. So this is definitely one of the unique demands of being a track and field athlete across the board. We could say from sprinting through even the 10K on the track is they're going to be wearing track spikes, and we could put track spikes into a relatively minimalist shoe category. So if we think about that, the Minimalist Index that was developed by J.F. Esculier a couple of years ago, it's kind of a way to just grade how minimalist is this shoe based on a few different categories. There's kind of like the amount of stack height underneath, the bending stiffness, any stability type elements. So traditionally, your track spike is going to be really as close to minimalist as it gets. A lot of them do still have a bit more bending stiffness to them, and especially some of the track spikes that have carbon fiber plates, which is not a new thing for track spikes. Actually, I know carbon fiber plates are very hot right now, but they've been in spikes for a while. The unique demand is the athlete is probably going to be just training in a regular shoe, whatever shoe works best for them, but they're going to have to race in a minimalist shoe.
The effect of the minimalist shoe on the runner is what? Obviously, we know there's an increased demand on plantar flexors.
Yep. So generally speaking, the more minimalist the shoe, say if we just compare like your more maximalist to more minimalist, the demand is shift to the foot and ankle. So more load to the muscles and joints around the foot and the ankle, including the plantar flexors and Achilles tendon. And then you kind of put that into the same mix of, well, all these injuries, most of the ones that we see in middle distance are from the knee down. And it kind of can be a bad combination at that point.
Some of those injuries being forefoot pain, for example, any specific injuries you just throw out there, Jason, that you have seen and you do see regularly?
Yeah, sure. I would say Achilles tendinopathy is still probably the most common one that I would see in middle distance runners. Your plantar heel pain, metatarsalgia spanning into bone stress injuries of the metatarsals, your medial tibial stress syndrome, or tibial bone stress injuries. That probably rounds out the large majority that I see in that area, with some occasional more rare ones like a tib post or a peroneus tendinopathy.
On this footwear exploration, Jason, there has been a lot of conversation, controversy, you could say, around the super spike, the advent of the super spike. So can you just paint a picture around what a super spike is and its proposed mechanisms of benefit, etc.?
Yeah, so the super name originally came from the super marathon shoe, or the super shoe. These high stack, great energy returning shoes with a carbon fiber plate in them that have this geometry that seems to offload the muscles in the foot and also not really make the ankle do any more work than it otherwise would. Those were introduced in 2016. We saw the earliest prototypes of them, and it's been pretty clear that they have helped with long distance running. The interesting thing is we don't really know what the shortest distance that those super shoes do help with. What World Athletics did is basically say, hey, you're not going to use those on the track. So they put a stack height limit on their track spikes, which prevented those super shoes from getting into the middle distance realm. Other than maybe some private labs that have tested it, we just don't know what those large high stack super shoes would do in, say, an 800 and a 1500 race. But what have been rolling out in the last couple of years are the quote unquote super spikes. So pretty similar elements. They're using the same type of foam that the super shoes use. So this PBEX foam looks like it returns almost 90% of the energy that you put into it in the high 80s. And for reference, the traditional EVA foam is in the low 60s. So much higher energy return in this foam. The carbon fiber plate, again, has been a part of track spikes for a while. The geometry of this curved carbon fiber plate creates a bit of this rocker bottom effect that some believe to help propel the body forward a little bit more and shift away some of the energy away from the Achilles. The interesting thing about the super spikes is that we still don't really know how much they can affect performance, because similar to if we kind of go back to the performance determinants of middle distance, where there's this percentage of aerobic versus percentage of anaerobic that goes into the performance, it's really hard to quantify how much is coming from each side of things. What the marathon spike or the marathon shoe can do is it can show that it improves running economy at submaximal speeds. But when you're running much faster than submaximal speed, it's a lot harder to figure out where that metabolic energy is coming from. And so that's probably one of the limitations for the super spike, where, in certain athletes, there's going to be different energy system contributions to their same performance. And that track spike is going to be kind of a confounding effect, I guess, between the two.
Lots to consider, and the speculation will continue. The opinions will continue. There's been a lot of conversation around the injury profile that super spikes or, the super shoes on the road can actually potentially bring about. Anything you'd sort of share there from your own anecdotal experiences, clinical experiences, or the science around injury profile with these shoes?
Yeah, I definitely haven't seen enough or enough longer term on the super spikes since they're relatively new. I know that there's some kind of anecdotal grumbling about runners who run in the super shoes, the marathon shoes, having more proximal injuries, but I don't know that I'm too sold on it yet. I do think what we typically see with changes in footwear is we just see different injuries. So we don't necessarily see more from a total amount, or we don't see less from a total amount either. We just see where the load has been shifted. And that's pretty consistent with this whole idea of injury prevention in running in the first place. Is are we reducing the total number of injuries we see, or are we just changing the ones that we see the most?
Jason, before we throw to a physical challenge for the week and your key solitary piece of advice to listeners, just looping back to an earlier conversation point around the unique demands of the sport and training principles, the unique demands of middle distance, I should say. It's well established that there's a polarized type approach to the majority of the world's successful endurance athletes. But do you see that 80-20 principle, if you like, 80% aerobic, 20% high intensity or anaerobic, if you simplify it, in the middle distance world? Or do you think it's a different percentage, or it varies?
That's a great question. I think so. It first depends on, are we talking about training sessions, or are we talking about time spent in the zone? And that's, I think, the most important thing to consider there off the bat, because if we're talking about training sessions that include things above your lower intensity zone, then the 800 runner is probably going to be like a 60-40 low intensity to high intensity, or maybe a 70-30. The 1500 runner might still actually fall in that 80-20-ish, but would maybe err on like a 75-25 as well. But then if we're talking about time spent in zone, I think it's actually going to be closer to like a 90-10 or 85-15 for both of those athletes, just because of the amount of race pace training that they would do, or the amount of higher intensity work above that threshold. The actual time spent in that zone relative to the total amount of just easy running they do is still very, very small, because running that fast is stressful on the body. So there really is, if your total training volume is that much, there's only so much that it can do to represent a 20%. So I think in that case, it's going to depend on how you categorize whether it's sessions versus time in the zone.
Yeah, and I know Dr. Stephen Seiler does tend to talk about sessions as opposed to the time, but there's varying opinions and applications there. And big topic. Jason, you have shared so well around this to date unexplored topic, which is a huge area, the middle distance runner. So thank you for sharing thus far. Every guest, though, Jason, gets issued 2 set questions. The first being, if Jason Tuori could boil everything you've learnt into one solitary piece of advice to help the listener of this show perform at their own physical best, what is Jason Tuori's solitary piece of advice going to be?
Yeah, this one's also going to be a pretty boring echo of probably a lot of things that folks have heard in the past. But the most effective endurance athlete, whether they're a middle distance runner, long distance runner, the most effective one is the one who can string together the most years of training uninterrupted by injury. So my bias as a physical therapist is that if you select a sustainable training plan and you do what you need to do to try to reduce your injury risk, then that's going to lead to high performance over time. So to me, it's about managing your previous injuries, listening to your body, trying to avoid excessive training spikes when you can, and finding out what's a sustainable training plan for you. Those to me are the only things that I can really fall back on to say, let's try to reduce that injury risk so that you can string together a lot of uninterrupted training.
Gosh, so practical, powerful, and also quite predictable, but it sticks. It does make me think of the maxim that Max Paquette shared prior on the show, and that was good training is unimpressive but uninterrupted training. And I think of that in my own workouts, and I try and really adhere to that. So mirror in exactly what you've just shared, Jason. Jason, a physical challenge for the week. I am curious. You're in upstate New York. You're in summer at the moment. What's this physical challenge going to look like?
Yeah, so I was going back and forth on what I was going to pick for this, but I think if anyone out there has not done an 800 time trial in a while, my challenge to them would be go to the track and your goal is to run an 800 time trial using a positive split of 2 seconds. So your first lap is going to be 2 seconds faster than your second lap. That's the challenge.
First lap, 2 seconds faster than the second lap. And that is brutal, Jason. And you are sharing that with a big smile on your face, and I know why. And if people take it on, they must let you know. And you're found easily over on Twitter, where you're quite active. Jason Tuori, spelt Tuoript, capital PT. So they must tag that in and show you or share with you their results. They can also find you over on Instagram, obviously, Jason Tuori, Tuori.dpt. And obviously you can find you on your excellent blog, which is howtomovement.blog. Just type in how to movement and your name, and that will appear. And I recommend that, particularly for practitioners. You've got a great review up there that we'll share in the show link in the show notes, and that is the Nike Vaporfly and High Performance Footwear, a literature review. Fantastic reading. So well done on that.
Yeah, thank you very much, and thanks a lot for having me on this podcast. Like I said, this is one of my favorite listens. It's always on when I'm on my way to work or on my way to the track for a training session. So to be a guest on it is a huge honor for me.
Jason, you've shared so well. So thank you for your generosity with your knowledge and your time.
Thanks a lot, Brad.
So there you have it, another episode of the Physical Performance Show. And I trust and I know you enjoyed today's share-ins on this expert edition from Jason Tuori. Now do reach out and let Jason know what it was that you enjoyed from his share-ins. You'll find Jason over on Twitter at Jason Tuori PT. That's Jason, capital Tuori, capital PT. You'll also find Jason over on Instagram at Jason Tuori, Tuori.dpt as well. Do take on the physical challenge for the week and consider a podsy. That's a screenshot of the episode that you're enjoying and tag it in the show at Physical Performance Show over on Instagram, and we will reshare your podsy. Of course, you can find links to all handles over on the show notes at pogophysio.com.au/podcast, and there we'll also link up to some of the papers that Jason referenced in today's expert edition. As always, a massive thank you to the great folk who make this show possible each and every week. Daryl Misson, our audio engineer, Susan Wilkin on all things show administration, and Matthew Aldian on all things show graphic design. Don't forget the upcoming live stream event featuring Rinnie McGregor on all things fueling the endurance athlete. Now, This was scheduled for September the 4th. However, due to some unforeseeable circumstances, we've had to postpone the live stream by several weeks, with the new date being the 23rd of October. Now, if you are unable to jump on 3 to 6 p.m. Australian Eastern Standard Time on that date, do not despair, because a post-event recording will be made available to all Patreon members and, of course, all registrants of the event. Tickets are available for $49 Australian over at pogophysio.com.au/Rinny McGregor live stream, or simply jump over to the bio link on Instagram. Massive thanks once again to today's show sponsor. We're thrilled to have our new partner on board, Polar, with their GPS watches, fitness trackers, online training platform, and state-of-the-art pioneering heart rate monitoring technologies. As you heard earlier in the show, Polar have so generously offered up 15% off any of their products. Simply jump over to polar.com and use the code TPPS, all capitals, to receive 15% off. And don't forget, if you are an endurance runner or triathlete struggling with lower limb conditions such as shin splints, kneecap pain, Achilles tendinopathy, then online telehealth consultations can help you get back to your physical best. Here's a little success story from Tasmanian-based triathlete Sarah, who got back to her physical best via telehealth.
Hey, I'm Sarah. I'm a competitive age group triathlete from Australia, and telehealth 100% works. I did telehealth with Brad for chronic sesamoiditis, and I didn't need any hands-on treatment. I had exercise prescription and load management with my training, and this, along with Brad's expertise and genuine care, got me across my pogo finish line.
Thank you, Sarah. Now, coming up on next week's episode of The Physical Performance Show, we keep the middle distance theme going, and we'll share with you a conversation that I recently had with middle distance star coach Justin Rinaldi. Justin is the head coach of the Fast 8 Track Club, hailing from Melbourne, Australia, and is the coach of Australia's Peter Boll, former featured performer of the show, who collected an incredible 4th place finish in the final of the men's 800 metres recently at the Tokyo 2020/21 Olympic Games, and also former Australian 800 metre record holder Joseph Dang. And Justin will lend his insights, tips and wisdom around all things maximising middle distance performance. So be sure to be tuning in to next week's episode of The Physical Performance Show. Until then, keep pursuing your physical best performance. I'm Brad Beer, and this has been The Physical Performance Show.